Hello there. I'm so excited to just introduce our guest for this session. We're talking about Black resistance. Let me start that over. Hello. So excited to be here today. Our theme for this conversation is Black resistance and activism. And as we know, the theme for Black History Month is Black resistance, and we really wanted to integrate themes of mental health around this topic. So I'm delighted to introduce our guest, Dr. Earl Turner, who is an associate professor at Pepperdine University out in California, and he's also the founder of Therapy for Black Kids. So Dr. Turner, tell us a little bit about who you are and what drives your passion for mental health.
Yeah, first, thank you so much for having me on. And so, for me, I got into this field primarily due to a underrepresentation of Black people in psychology. And so it's always been my mission to, one, just sort of be a face and presence within the field, but also really to understand some of the barriers that prevent the Black community from accessing care and trying to figure out ways that we can reduce some of the stigma and negative perceptions around mental health. And so a lot of my work and research has focused on understanding those barriers. And with Therapy for Black Kids, being able to provide that space where we can help families get connected with therapists around the country, as well as provide resources and tools about how do we engage in healthy conversations about mental health and how do we help kids to develop resilience to some of these negative experiences that they have due to racism and discrimination within society. And so that is the bulk of what my work is focused on and why I'm passionate about this information.
Awesome. So you sound very busy just in that brief introduction. So I'm excited about, I see you doing lots of media interviews and just your work, just such an inspiration to myself, but also others around. So thank you for all that you do in promoting mental health and really addressing stigma as well. So thank you for that. So we're going to go dive really quickly into our conversation. And, one of the things just in exploring your work and doing some research around you, I discovered this article that you created or wrote in collaboration with some other researchers around the Black model for healing and resistance. And Black, BLAC, stands for Black love, activism, and community. So tell us a little bit about what was happening in the community that guided you to create the Black model for healing and resilience.
Yeah, no, thank you for that question. So this particular conceptual model was co-created by myself and two other colleagues here at Pepperdine University, Dr. Tamar Bryant and Dr. Shelley Harrell, who have done a lot of work around Black mental health over the years. And so we came together during 2020 when there was the racial reckoning and after George Floyd's death, we thought that there was a need to really highlight and understand what are the ways that one, individuals are engaging in activism and work and how does that impact their mental health. But also we know that there is research that talks about how activism can also be healing and empowering as well. So we really wanted to sort of pull together what are the ways that we understand how sort of racism and discrimination or racism-related stress can impact individuals' mental health, but also how does that drive some individuals to maybe want to engage in activism because we want to sort of address some of these oppressive systems within society and change up that narrative about how we're perceived as individuals. But obviously, when you're doing that work, you're also putting yourself potentially at more risk or exposure for incidences of racism and discrimination. And we've seen that, with the number of, protests and rallies where people are peacefully having, conversations or talking about these issues. And then the police comes in and you get this sort of retaliation against the community. And so I think that was the real reason why we sort of came about with this particular model. We're really connecting all of those dots about how racism-related stress or racism sort of is connected to engaging in activism, and then what are the ways that we can think about these healing approaches that may be inherent within our culture, but also the ways that clinicians need to think about how do we address Black mental health in the midst of those that may be engaged in activism.
Yeah, thank you so much for that. I think that just captures kind of that duality, right? And I've seen it, firsthand working with activists here in the Boston area, how that commitment to change and, really advocating and organizing their community, but sometimes neglecting their own mental health in the process of that and feeling this kind of guilt if they take time to step away, right? Like they're
Absolutely.
somehow abandoning their efforts. So as we think about that, what are some of the specific mental health or emotional well-being concerns that you've seen facing activists?
Yeah, I think one of the big things that we've seen over decades is how does engaging in this type of work, or how does experiencing a racism and discrimination lead to increases within anxiety or depressive symptoms. And I think there was a study that was published, some data. I think the CDC had collected some data during 2020. One, looking at some of the pandemic related stuff, but also after the George Floyd killing, that there were these spikes in anxiety and depression symptoms among the Black community. And so I think that's sort of one of the big things that comes up for me is how do we think about, for people who are engaging in this work, what are they doing to sort of protect their mental health, to address some of these potential concerns around things like anxiety and depression. And a newer study more recently also highlighted how experiences of racism and discrimination can lead to increases in suicidal thinking, and we've seen these spikes or sort of continued rises in death by suicide within the Black community. And so I think sort of tying all of those pieces together, really understanding how there is this sense of hopelessness that can come about for people who may be engaging in this activism work, or just sort of experiencing racism. And so how do we sort of address that to make sure that people are able to get the healthy coping skills and tools that they need to address those concerns, so that we don't get some of these more severe sort of outcomes that we can think about in terms of mental health.
Yeah, I think that's such an important point. So not only seeing increases in anxiety and depression, but also seeing some suicide, some deaths by suicide. And I think, sometimes people see people at the front lines and just their passion, their energy, and they don't see the other side, what happens behind those closed doors. And I think it's such an important point, because sometimes people, they can get burned out, right? It is so much, and that you mentioned that hopelessness, right? That hopelessness can come when people feel like their efforts aren't really making change, right? They're doing all this work and they're not seeing that change. So I think those are really important points. And again, helping people to think about their social supports, right? How are you making sure you're building community that's outside of the issues that you're advocating for? How are you taking rest? Take a little bit from Trisha Hersey's rest is resistance. So how do we, prioritize stepping away? Stepping away doesn't mean you're quitting or giving up. It means that you're refueling yourself. So what are some other things that you might suggest for people who are leading activism initiatives in their community? How do they pay attention to their mental health and well-being?
Yeah, I think, one, just sort of piggybacking off of the point that you made about sort of rest as resistance. I think that's a huge area that we need to sort of continually encourage people to think about. Obviously, doing their work is important, and sort of for people that are doing it, they recognize that. But I think also understanding that you're not the only person that has to do that work. And so I think that's a piece, even for myself, that I begin to sort of realize is that I can allow myself that time that I need to like step away and take a break. And there will be other people that will sort of fill in that gap. And so I think that's really important for, organizations and people that are sort of leading this type of work to really recognize that, there are other people doing this work, and that you can allow yourself some grace to step away, for a couple of days or a week to be able to do that work. And obviously, I definitely understand that pressure that you may feel from others or even from yourself about doing this work, but also acknowledging that, biologically our bodies need that rest. And so if we continue to put ourselves under that pressure and stress, that cortisol and all those other hormones are not going to have a positive impact on either our physical or mental health. And is important to sort of take that break. The piece for me too is making sure that we balance sort of understand that there's negativity or these experiences of oppression with some aspects of joy. And I think that that can be hard sometimes to, want to have joy in the midst of all of this negativity or this trauma that, our communities are experiencing. But I do think that it's important that we recognize that what are these positive things that are going on? How can I make some, have some fun with my community or the people that I'm engaging in this work with, so that way we're not always down in the dumps about, all of these hardships that we may be experiencing as people. So I think that's another area that's really important in terms of like, is it music? Is it dance? Is it poetry? All of those things that we can think about that are really unique to our culture, that we actually embody those pieces throughout this work. And then the other piece for me too is making sure that people who are leading this work also focus on providing their community and those that are engaging in the activism with them with healthy coping tools to make sure that people, know one, where are the resources in that community where they can seek out that, psychological help and support. So if they need therapists, are there ways to sort of connect that? And I think, you have done a lot of work with that in terms of like directories that do exist. And so making sure that you provide those, resources for people in terms of if they want to get that support, they know where to go. Because sometimes people want help, but they don't know who they can trust or who to seek that help out from. And it's not easy. I mean, one of the things that I do with Therapy for Black Kids is like people contact us because they struggle with finding Black therapists in their communities. And so we do some of that background work to say, these are some people who are connected, in your community that you may be able to sort of find that support from it. And that sort of work can be challenging for some people to like, okay, I'm stressed that I'm dealing with all of these other things. I don't have time to like search through a directory to find, someone who looks like me that can provide my services. So I think that's really helpful. And then making sure that people have those other tools, like, as psychologists and therapists, we know like practicing breathing exercises, thinking about positive affirmations, all of those things can also be really helpful and useful in the midst of doing this type of work.
Yeah, man, those are some amazing tips. So let me try to capture them again. So you talked about, you definitely affirmed the rest is resistance piece. You talked about, being intentional, just step back. Like it's okay to step back. And I might say, as people take a step back, you mentioned that there are other people who can do the work. And I think, for those activists listening, I also think about who you put on your team, how you build your team, so that there are people you can say, okay, I'm going to hand this off to you now. So being intentional to say, okay, I'm handing off, I'm going to take some step back. You can step up now. So I think building in that leadership is really important. You also talked about, centering your wellness, right? How are you making sure that you're centering your wellness, not just for you, but also the people who are working with you? As you think about starting those meetings, maybe you start with a breathing technique or, again, so I think we often will say this, and I think this is to your point too, right? We often tell people, take care of yourself, but we don't show them how to do it. We don't model how to do it. So I think those are some really important parts. And then of course, therapy. So, finding therapists, whether it's through the InnoPsych directory, lots of directories that are out there. You're doing a lot of work with Therapy for Black Kids around families and making sure families have the support. So there are definitely lots of resources out there. We try to make it easy for people to ask for help. That's a big thing in our communities really too, is like how to ask for help and then how to just receive it, when it comes to you. So any last words? I think these were just some amazing tips. I really appreciate kind of your time and your presence and the work you're doing, but any last words before we close out for today?
I think, the big piece for me is like finding that safe space in that community that is important for you. And that looks different for everybody else. So I think, we can have family and friends that we're connected to, but that doesn't mean that they're always the best person to go to in situations where we need to sort of decompress and talk about things. So I think it's really important to find like, who is that person that can be there for you, present to listen and support you, as opposed to someone who may give you all these other types of advice that may not be as helpful or can be present. So really just sort of figuring out like, what is it that you need, and finding that person that can give you that support to sort of get through these moments.
Yeah. Excellent tips. Thank you so much for sharing that. Great suggestions. And I can continue and wish you luck on your journey. And again, thank you for joining in this conversation about Black resistance and mental health. Take care.
Thank you so much for having me.
Thank you.